you will receive a government subsidy to lose weight. Yes, because obesity is not just a health problem, it is becoming a national economic issue, affecting hospital bills, productivity, government budgets, and even GDP. The France government has decided to subsidize the weight loss treatment. They are going to reimburse the cost of medicines like Wegovy and Mounjaro for the severely obese patients from the mid of June 2026. They are going to reimburse around 65% of the medicine costs, which is going to cost them 100 million euros per year, targeting around 1 million patients who are in the high risk category and not just casual weight loss users. But why would a government spend public money on weight loss treatment? Because the calculation is very clear. Spend today on obesity treatment and possibly save tomorrow on diabetes, heart diseases, kidney failures, dialysis, hospitalizations, and the loss of productivity. If you look at the global numbers, around 2.5 billion people in the world are in the overweight category. Out of that, 890 million people are living with obesity, which means this is not a small lifestyle problem. This is a global economic issue. The World Obesity Federation has estimated that the economical impact of the overweight and obesity could cross $4.32 trillion by 2035, which is nearly 3% of the global GDP. Now think about what that means. Obesity increases the healthcare expenses, it reduces the productivity, it increases the insurance claims, the burden on the public hospitals, it increases absenteeism, and it reduces the number of healthy working years of the population. So for a government, obesity is like a hidden fiscal deficit. So it does not appear directly in a budget like a defense expenditure, but it quietly increases the medical expenses and reduces the economic productivity. Now in India, around 23% of the women and 22% of the men are overweight by the BMI criteria. But the Indian problem is still more complex because even at the lower BMI levels, Indians develop hypertension, diabetes, fatty liver, and heart risk because of the abdominal fat and metabolic risk. And India also has other public health priorities like malnutrition, cancer care, maternal health, and primary health care. So a blanket subsidy for the weight loss treatment would be very difficult. But India can follow a different model. Cheaper generic medicines, private prescriptions, and insurance coverage for the high risk patients. So, is this a social or an economic issue? It is both. It is a social issue because the modern lifestyle, stress, processed food, screen time, long working hours, lack of sleep are pushing people into obesity. But it is also an economic issue because the bill is being paid by everyone: individuals, employers, insurance companies, and the government. When a country has more lifestyle diseases, the government spending increases. So France is not simply subsidizing the weight loss treatment, it is also trying to reduce the future liabilities. This is the new economics of public health. Prevention is cheaper than the treatment.